So for listening part B, you may have 6 questions and 3 option MCQs, and you need to choose the most appropriate option out of this 3. And all the 6 audios will be different. And details on this is added in your orientation video. Again, you will get access to orientation video. If you just talk to Gia ma'am, she will definitely give you access to orientation video where I have clearly explained what each reading, listening, and writing is all about. Okay, all right. So let's start today's session. Here we go. Right. So when it comes to listening, part B, so before we listen to each extract, they will give you an intro, or they will tell you what the extract is all about, and who is talking to who. So it is told beforehand in the audio for each question what is the context and who is talking to whom. Then during the 15 seconds preparation time, you will read the question and you will try to understand what exactly have they asked us to find out. Then you will go through each option and try to understand it. Okay, so that's it. So they will read the context sentence. So when they read the context sentence, you need to understand who is talking to whom, about what. Then keeping the context sentence in mind, during the 15 seconds, read your question and make sure that you understand what exactly have they asked you to find out. Then, of course, when the audio plays, after you read the question, you might have read the options. Then when the audio plays, figure out which option would be the most appropriate. Okay, let's start. Here we go. So let's start with our first question for today, this one. Okay, all right. Okay, so Asma, if you don't mind, can you unmute yourself and read the sentence for me, please?
Good morning, ma'am.
Good morning, Asma.
Nurses handling over a patient at the change of shift.
So you're going to hear an audio where 2 nurses are doing a handover. Okay, all right. Now, can you read the question for me, Asma?
What should the incoming nurse do?
Okay. What should the incoming nurse do first for the patient today? I want all of you to go through the question. What should the incoming nurse do first for the patient today? So what exactly have they asked us to find out here? What should we find out here? Saina, Asma, what do we need to find out here? Come on, tell me, what do we need to...
ma'am.
Whose action? Whose action?
Nurse. First action.
Incoming nurses. First action for today.
Nurse, ma'am.
Yes.
Incoming nurse.
Incoming nurses. First action for today. First action for today. Not tomorrow, not yesterday. First action for today. So the incoming nurse needs to do something today. We need to figure out what exactly should the incoming nurse do today. So that's what we need to find out once we listen to the audio. So Asma, can you read the options one by one? Unmute yourself, you're on mute.
Yes, ma'am. Organize some further investigations.
So should the nurse organize, should the incoming nurse organize some further options? Is that her first action for today? Organize further investigations. Okay, next option, Asma.
Implement agreed changes to his medication.
Implement, that means make some agreed changes to his medication. So is that what the incoming nurse needs to do, that the nurse needs to make some changes to his medication today? Is that her action for today? Last option, Asma.
Begin to make arrangements for his discharge.
Or should the nurse make arrangements? Or should the nurse make arrangements for the patient's discharge? So among these things, what exactly do you want what exactly should the incoming nurse's first action be for today? So all of you go through the scenario, go through the question, go through the options. So this is a handover. We need to figure out the incoming nurse's action for today. Should the nurse be organizing more investigations, or should the nurse implement the already agreed changes on patient's medications, or should the nurse make arrangements for the patient's discharge? Okay, all right. So I'm going to play the audio. I want all of you to carefully listen to the audio and figure out the answer. Give me a second. Let me share the audio here. All right. So before I share the audio, I want all of you to check whether it is audible to all of you.
4. Test 2 Exam Practice Listening. Part B. In this part of the test, you'll hear 6 different extracts.
Was that audible? All of you? Was that audible?
Yeah, ma'am.
Okay,
Yeah, ma'am.
perfect, perfect. Let me take the first question. Get ready. Here we go.
PD and was
Get ready. Yeah.
So in bed 8 we have Mr. Ferris, who has chronic COPD and was admitted via the emergency department with suspected pneumonia.
Okay.
He's been feeling slightly better on my shift. His temperature is 37.3, pulse is 69, respiratory rate of 16, blood pressure 129/80. His chest x-ray of last week showed a stable left lower lobe infiltrate, but only normal throat flora showed up on his culture. Having said that, his urine antigen was positive for strep pneumonia. So the doctor's assessment is that the pneumonia is steadily improving. The plan is to discontinue his IV ceftriaxone as of this morning and continue his oral azithromycin.
Right.
If he continues to improve, it looks like he might be ready to go home tomorrow. He's alert and oriented, so we could share that information with him this afternoon when his wife comes in, just to see if there are any issues their end.
Sure.
Okay, what do you guys think is the answer? Is it A? Is it B? Is it C? Which one is it? Which one is the answer?
B.
B. Okay, all of you agree? Is it B? Come on, tell me. Okay, Asma, Saina, others, what do you guys think? What is the answer? Okay, answer is B. Let's see why that is. Okay, all right. I want all of your attention. Here we go. Let's check the answer. Let's understand the audio and analyze it. So here we go.
So in bed 8 we have Mr. Ferris, who has chronic COPD and was admitted via the emergency department with suspected pneumonia.
So they are like, in this particular bed, we have this particular Ferris, patient's name is Ferris. He has been admitted with COPD and they suspect that he has pneumonia.
Okay.
He's been feeling slightly better on my shift. His temperature is 37.3, pulse is 69.
So the patient, the nurse who is handing over the shift, the nurse, he explains, the patient's vital sign, how he is, how he's feeling better than before, all those things.
Respiratory rate of 16, blood pressure 129/80. His chest x-ray of last week showed a stable left lower lobe infiltrate, but only normal throat flora showed up on his culture. Having said that, his urine antigen was positive for strep pneumonia.
So he explained all the vital signs, and he's like, his urine test showed signs of pneumonia.
So the doctor's assessment is that the pneumonia is steadily improving.
So the doctor's assessment is that, right now, last week's, this one showed this one. So now the doctor is saying his condition is improving. But let's listen. So far we haven't got the answer.
The plan is to discontinue his IV ceftriaxone as of this morning and continue his oral azithromycin.
So then the nurse says, what? Our plan is to stop his IV medication and start azithromycin orally. So that's the plan. So when something is the plan, that is something that is supposed to happen. Okay. So we are going to stop his IV today and we are going to start oral medications. That's what the nurse says. Okay. Let's continue. So that's exactly is the plan. That means that is something that they should do today. Okay. Let's continue listening.
Right.
If he continues to improve, it looks like he might be ready to go home tomorrow. He's alert and oriented.
So they are like, if his improvements continue to happen, then he can go home tomorrow.
So we could share that information with him this afternoon when his wife comes in, just to see if there are any issues their end.
So he's not asking the other nurse to make arrangements. Rather, he's saying to that other nurse, what? When his wife comes in the afternoon, you can give that information that if his condition continues to improve, he can go home today. Share that information with him in front of his wife, so we can assess whether they have any issues. So he's not asking her to make plans for her or make arrangements for his discharge. Rather, and nowhere they have said that there is a need to organize more investigations. So A and C are not the answers. Again, B is the answer where they say oral azithromycin that should be started today. So that's why B is the answer. Okay. All right. Let's move on to the next question. Blessy, can you read the next scenario for me, please? This one. Yeah.
You hear a senior care home nurse briefing her team about patient mobility.
So Blessy, who is talking to whom about what?
A senior care home nurse
Is
briefing her team
about?
patient mobility.
So here a senior care home nurse is talking to her team and the topic is patient mobility. Blessy, can you read the question for me, please?
The video that they are going to watch will focus on.
The video that they are going to watch will focus on. So what do we need to find out here, Blessy?
What is the content in that video?
Is it the content or something much more specific? So it's something related. Is
No.
it what specific aspect of the video? The videos? Read the question. The video that they are going to watch
What
will
the video focus?
focus. The videos focus. So we need to figure out when we listen to the audio, we need to figure out what exactly does the video focus on. So Blessy, can you read each question with the options for me, please?
The video that they are going to watch will focus on convincing patients of the need to move out of bed.
So is that the video? Is that what the focus of the video is? Is about persuading, convincing patients the importance of moving out of the bed. Is that the focus of the video? That the video will convince the patients the importance of getting out of bed. Next option, Blessy.
The video that they are going to watch will focus on identifying which patient it is safe to move out of bed.
So will the video focus on identifying, finding out which patient is suitable to, or it is safe for which patients to get out of bed? Okay, is that the focus of the video? That the video will focus on identifying, finding out among the patients who are for whom is it safe to get out of the bed. Last option, Blessy.
The video that they are going to watch will focus on helping patients who would benefit from moving out of bed.
Or will the video help those patients who for whom it will be good to get out of the bed? So is the focus of the video, is it about convincing patients to get out of bed, or is it about identifying which patients can get out of bed, or is it about helping those patients who would for whom it would be good to get out of the bed? So what is the focus of the video? Is it about convincing? Is it about identifying? Is it about helping those patients for whom it is important to get out of the bed? Okay, so take a second, all of you, go through the question. All of you, come on. Okay, so let's have a look at the audio. Here we go. Let's listen to the audio. Please get ready. Here we go. Somewhere here.
Today, I'd like to show you a video about patient mobility. Now, experience tells us that our patients may have difficulty getting out of bed and often need to be encouraged to sit in a chair instead. We can remind them of the medical reasons, that it can help prevent chest infections, normalise blood pressure and increase stamina. And of course, we know it makes them more likely to socialise and participate in their surroundings. So the clip I've selected goes through the steps in guiding a patient transfer from bed to chair. The assumption being that the patient has minimal or low handling risk, but needs assistance from a member of staff. Now remember, to perform this manoeuvre, patients should be clinically stable, be able to bear their own weight and initiate their own movements, and they must be capable of understanding and following instructions. Let's watch.
All right, what do you guys think is the answer? What do you guys think is the answer? Come on, tell me. Is it A, is it B, which one, which option? Is the video trying to convince patients, or is the video trying to identify patients, or is the video trying to help the patients? What do you get?
Option C.
Option, okay, option B, C. Okay, I understand the confusion. So answer is actually C. Let's see why. Okay, so let me tell you one thing. She gives a lot of, first, before she gets into the video, she gives a lot of other information. Then she talks about how the video will guide the patients. Then she again talk about how it is, so for people who needs to get out of the bed, we need to know for whom it is safe. So there is only one sentence where she actually mentions the video. The remaining is extra information. Let's understand. Let's understand. Okay, here we go.
Now, experience tells us that our patients...
1 second, yeah.
Today, I'd like to show you a video about patient mobility.
So she's like, you know what? Today I'm going to show you a video where it talks about it is about patient mobility. Okay, let's continue listening.
Now, experience tells us that our patients may have difficulty getting out of bed.
So she's like, based on our experience, we know. So she's not talking about the video. She said, I'll be showing you a video. Then she's like, from our experience, we know that, getting out of bed is a problem for patients.
And often need to be encouraged to sit in a chair instead.
So sometimes we need to encourage them to sit in a chair instead, because they might not be able to they might not be ready to get out of bed and move around. So sometimes what we do instead, we'll encourage them to sit on the chair. Okay, so she's not talking about the video. She's just giving some information. Let's continue.
We can remind them of the medical reasons, that it can help prevent chest infections, normalise blood pressure and increase stamina. And
so from our experience, we know how difficult it is, and we can also try to encourage these patients to get out of the bed by telling them the advantages of doing that, how it will stabilize their blood pressure, how it is good for this, so on and so forth. So still she's not talking about the video. Okay, so yes, convincing, encouraging the patients by giving the reason. She just says it because she said from our experience, it's difficult to get the patient to move around. So in order for that to happen, we need to encourage the patient by giving them the reason, convince them about the reason to get out of the bed. So here she's not talking about the video. So that's why we can reject option A. Convincing, making them do something. So she's like, you need to encourage them by giving them that it's good for their blood pressure, it's good for their all those things. But she's not talking about the video, so we can reject option A. Let's continue listening.
Of course, we know it makes them more likely to socialise and participate in their surroundings.
So she's like, and we'll encourage them by saying the benefits. We'll tell them that, how it will help them to socialize, so on and so forth.
So the clip I've selected goes through the steps in guiding a patient transfer from bed to chair. The assumption being that the patient has minimal or low handling risk, but needs assistance from a member of staff.
So let's listen to that again. She says the video will give guidance. Let's listen to that again.
Socialise and participate in their surroundings. So the clip I've selected...
So now she talks about the video. She's like, the clip I've selected
goes through the steps in guiding a patient transfer from...
So the clip I'm going to show you will show you the steps in guiding the patient...
bed to chair.
Bed to chair. So the video is going to guide the patient, give them guidance on how to get the patient from bed to chair.
The assumption being that the patient has minimal or low handling risk, but needs assistance from a member of staff.
So this clip will tell you or give you guidance on how to get the patient out of the bed to the chair, all those things. So this whole idea is under the assumption that in order for this to work, we believe that your patient should be of lower risk and the patient can be moved with the help from the staff. Okay, so she's not talking about that the video will identify. She's saying the video will give you step-by-step guidance on how to get the patient out of the bed onto a chair under the assumption that the patient is of low risk and they can manage with the assistance of a staff. Okay, so that's why guidance, step-by-step guidance. So that's why C is the answer. Let's continue listening.
Now remember, to perform this manoeuvre, patients should be clinically stable, be able to bear their own weight, and initiate their own movements.
So she's like, remember, so she has told what the video focuses on. Then she says, another one thing, you need to remember that your patient should be of lower risk. The patient should be able to, have the ability to maneuver and all those things. So yes, she says, she mentions about reminding the staff to know that whether it is safe for the patient. I didn't make sure that your patient has the ability to move. It is safe for them to move. So that's not in regard with the video. The video sentence is over. Then she says, remember, you need to remember for whatever you see in the video to work, your patient should be of, this one.
Assistance from a member of staff. Now remember to...
So this sentence is for the staff. It's not about the clip. It's about generally to the staff. Remember, for this to work, for you to follow the video.
Perform this manoeuvre, Patients should be clinically stable.
So for this to happen, your patient should be clinically stable.
Be able to bear their own weight.
They should be able to bear weight.
And initiate their own movements.
And they should be able to move, have the ability to move around.
And they must be capable of understanding and following instructions. Let's watch.
So she talks about what the video contains. Then she says, whatever in the video, for that to happen, remember your patient should be stable. Your patient should have the ability to move themselves, initiate movements and listen to instructions. So B is not the answer. She's not saying the video will help us to identify. The video gives step-by-step guidance. You need to remember that your patient falls under the category. So C, B is not the answer. B is said, but it's not in connection with the video. Rather, after mentioning what is in the video, then she says, you need to remember that your patient is stable and it is safe for your patient to move. Okay, so that makes C your answer. Okay, it is tricky. Yeah, it is. You might feel B is the answer because after talking about the video, they will ask this. She's asking the staff to remember that their patient should be clinically stable. That doesn't mean that is the focus of the video. The focus of the video is this, giving guidance, step-by-step guidance to take care of the patient, to get out of the bed to the chair. Okay, so Blessy, Asma, Saina and others, are you clear? Do you have any questions about this? Did I convey myself clearly on why C is the best option? Yes?
Yes, ma'am.
Okay, perfect. Let's move on to the third. Okay, perfect. Let's move on to the third question for today. Saina, would it be possible for you to read the third scenario here, this one?
No. Yes, ma'am. You hear a community nurse talking to a patient.
So here, who is talking to whom?
Community nurse.
Community nurse is talking to a patient. Okay, can you read the question, Saina?
What is the patient most concerned about?
All of you look at the question. Tell me, what exactly should we find out here?
Patient most concerned.
So that means patient's biggest concern. Patient's biggest concern means worry. Okay, something that is bothering the patient. What is that biggest bother or biggest concern? Okay, Saina, can you read the questions one by one?
Yes, ma'am. What is the patient most concerned about? The level of discomfort that he is experiencing.
So, okay, this question this question ends in a question mark. So just read the option. That's more than enough. So, is the patient most concerned about the level of discomfort that the patient has? Next option, Saina, just the option.
How certain types of treatment might affect his work.
So is the patient concerned about how certain types of treatment will affect his work? Last option, Saina.
What the underlying causes of his symptoms might be.
Or is the patient worried about the cause of his symptom? So we need to figure out what is the patient's biggest concern. Is it the level of discomfort that he is experiencing right now? Or is it how some types of treatment can affect his work? Or is he worried about the underlying cause of his symptoms? All of you take a second, go through the question, go through the extract, go through the options, all of you. Remember, we don't need to read the question together if the question is ending in a question mark. Okay, if it ends in a question mark, just read the question, just read the option. We read them together only if the question is an incomplete one. Okay, where it doesn't end in a question mark. Okay, so let's listen to the audio. Get ready. Here we go. Somewhere here.
That's the injection.
The audio will start in a second.
So, that's the injection all done. Is there anything else I can help with?
Well, there is actually. I think I may have broken my finger. It's really weird because sometimes it's almost as if I've lost control of it, especially first thing in the morning. It's all bent double and it takes time to get moving properly. Even then, it doesn't move as quickly as the others. It kind of lags behind. Then other times, like now, it's back to normal. The thing is, I'm at a keyboard all day because that's how I make my living, so I really can't afford to have it in plaster or strapped up. The really weird thing is, it doesn't hurt at all. You'd think it would if I'd broken it, wouldn't you? Do you think I should see the doctor?
Maybe. Can you show me which finger it is?
Okay, what do you guys think is the answer? Is it A, is it B, is it C? Which one? Come on, tell me, come on. Tell me.
B.
B. Okay, what about others? Asma, Saina, what do you guys think? Is it A, is it B, is it C?
C, ma'am.
C. Okay, all right. Actually, the answer is B. I understand why you were confused. Let's analyze it. So, answer is B. Okay, he says about. Okay, let's listen. Let's listen. Let's not imagine. Let's listen. Okay, here we go.
I can help with?
Okay, right here. Okay.
So, that's the injection all done. Is there anything else I can help with?
So the community nurse have given some injection to the patient, and she's like, you know what? Do you need anything else? Do you need any other help?
Well, there is actually. I think I may have broken my finger.
So he's like, I think you can help with me because I think I may have broken my finger.
It's really weird because sometimes it's almost as if I've lost control of it.
So he's like, sometimes I feel like, I cannot control my finger.
Especially first thing in the morning.
Especially early in the morning, I feel like, I lose control of my finger and something is wrong.
It's all bent double and it takes time to get moving properly.
So actually the finger is actually bent, and it takes some time for it to come back to, normal this one position.
Even then, it doesn't move as quickly as the others.
And compared to my other fingers, I cannot move it in the same way.
It kind of lags behind.
So there is some issue with its movement. It's not as equally working as compared to the other fingers. It's not working the same. There is it is lacking, or it's lagging behind. The movement is not is not complementing with other fingers.
Then other times, like now, it's back to normal.
So now, as you can see, there is no issue. But early in the morning and some other times, I have a problem with the finger. And okay, so he's still talking about the finger. He has not told that he has any discomfort. He just says that early in the morning, it's bent. Its movement is, a bit lag compared to the other fingers.
The thing is, I'm at a keyboard all day because that's how I make my living. So I really can't afford to have it in plaster or strapped up.
So he's like, what I work with computers, and I need to be in front of the keyboard a lot. So if you apply a plaster cast or something like that, that won't work out for me. Such treatments won't work out for me because he needs his hands to work, because he uses a keyboard for his work. Okay, so that makes B your answer. Okay, that sentence is the one that confirms that B is the answer. But let's reject A and C. Let's continue listening.
The really weird thing is, it doesn't hurt at all.
So there is no, option A says there is a level of discomfort, but the patient clearly says it does not hurt at all. So there is no discomfort. He's not worried about it. He just says it's a weird thing, not worried as also. Okay, it doesn't hurt at all. That's the weird thing. Okay, so a level of discomfort, there is no question about discomfort because it doesn't hurt. He's not feeling any discomfort. He just has these problems. That's it. So we can reject A. Let's continue listening.
You'd think it would if I'd broken it, wouldn't you? Do you think I should see the doctor?
Maybe. Can you show me which finger it is?
So actually he's like, so do you think it is a broken finger? So nothing, no answer. Nobody is discussing about what causes here. Causes, no, nobody is discussing that. So C is not mentioned. Okay, all right. So take a second, go through it. Saina, is it clear? Causes are not mentioned anywhere. He is worried it's broken. He says it's broken. So, but the option says causes. Nobody talks about causes at all. Only the patient says broken 3 times, but not causes. So that is not it. Okay, all right. So I'm moving on to the next question. 4th question for today. Blessy, can you read the scenario for me, please?
You hear a primary care doctor talking to a practice nurse about a patient.
So who is talking to whom about what?
Primary care doctor
talking to
a
practice nurse about the patient. Okay. So can you read the question for me, please, Blessing?
What is the doctor requesting?
So we need to figure out the doctor's request. Okay. Can you read the options one by one?
Regular feedback on the patient's progress.
So is the doctor requesting for regular feedback on the patient's progress? So the doctor is talking to a practice nurse. So is the doctor requesting regular feedback on how the patient is doing? Next option, Blessing.
An informal assessment of the patient's mental state.
Or is the doctor requesting for an informal assessment, not formal assessment of the patient's mental status? Next option.
Advice on whether home visit would be more appropriate.
Or is the doctor asking the nurse for advice on the appropriateness of home visits? So is the doctor requesting regular feedback on the patient's progress, or is the doctor asking the nurse to perform an informal assessment of the patient's mental state, or is the doctor asking advice on whether home visits would be more appropriate for the patient? All of you take a second, go through the question, go through the options. Get ready. I'm going to play the audio in a second. Get ready. The audio will play at any second.
Could I going to be seeing Mrs. Could I have a word with you, Molly?
Yes, sure.
You're going to be seeing Mrs. Walsh. She's an 82-year-old lady who's coming in to have a dressing change following minor surgery on her varicose veins.
Oh, yes. I know Mrs. Walsh.
Great. Well, when I saw her, I was a bit concerned that she seemed to be a bit disoriented and confused. She picked up a UTI when she was in hospital and so ended up staying longer than planned. She's mobile, so she'll be coming into the clinic. Otherwise, it would be something the community nurse could follow up. Could you just keep an eye on her, get her talking, and see if there's any cause for concern? If there is, we'll have to think about setting up something more formal.
Sure. I'll report back to you either way.
Yes, please.
Okay, what do you guys think is the answer? Come on, tell me. Let's see, Asma, Saina, what do you guys think? Others, what do you guys think?
Option C.
Option C. Others, what do you guys think? So, Blessing, your answer is C. Others, Saina, Asma, what did you guys get? Come on, tell me. Come on. What did you guys get?
I think C, ma'am.
C. Okay. All right. My answer is actually B. Okay. Let's listen why that is. Okay. He doesn't ask her advice on the appropriateness of home visits. Let's listen. Let's not imagine. Let's listen. Okay. I want you guys to pay close attention here. Here we go.
With you, Molly? Could I have a word with you, Molly?
Yes, sure.
So the doctor asked the nurse Molly's permission to speak to her, and she's like, of course, tell me what can I do?
You're going to be seeing Mrs. Walsh. She's an 82-year-old lady who's coming in to have a dressing change following minor surgery on her varicose veins.
So this particular patient, Mrs. Welsh, she has had a surgery on varicose vein, and she's coming in to change her dressings. So that's who they're talking about.
Oh, yes. I know Mrs. Walsh.
Great. Well, when I saw her, I was a bit concerned that she seemed to be a bit disoriented and confused. She picked up a UTI when she was in hospital and so ended up staying longer than planned.
So this patient who came for the surgery, while she was here, while she was admitted in the hospital, she got a UTI. Now, while the doctor was carrying out the assessment, the doctor noticed that the patient was a bit disoriented and confused.
She's mobile, so she'll be coming into the clinic. Otherwise, it would be something the community nurse could follow up.
So this is, listen to that. Doctor is not asking the nurse advice on home visit. Rather, the doctor is saying, here, listen to that.
Clinic. Otherwise, it would be something. And she's mobile, so she'll be coming into the clinic.
So the patient is able to move. That's why the patient is coming to the clinic. Otherwise, a community nurse would have handled this. That's what the doctor is saying. The doctor is not asking or requesting for advice. Rather, the doctor is saying, you know what, this patient appeared to be disoriented and confused, and but she's able to walk. That's why she's coming to the hospital to get her dressing changed. If that was not the case, she would have gone to a community nurse would have done this. Okay, so doctor is not saying that the patient needs community nurse. The doctor is like, she's able to walk. That's why she's coming here. Otherwise, her dressing would have been done by a community nurse. He's not asking. He's like, if she was able to move, then this would have been taken care of by a community nurse.
Otherwise, it would be something the community nurse could follow up. Could you just keep an eye on her?
That's from where our answer starts. Could you just keep an eye on her?
get her talking and see if there's any cause for concern?
Talk to her and see see that are there any causes for concern? Are there any reason for us to be concerned about? So could you please have a word with her? Could you please keep an eye on her, talk to her, and see whether there are any reasons for concerns? And let's continue listening.
If there is, we'll have to think about setting up something more formal.
If there is anything, if once we talk to her and if there is a cause for concern, then we will do something formal. So that means he's asking her, could you please keep an eye on her? He's requesting her to talk to the patient and find out whether there are any cause for concern. If there are concerns, then they can go for a formal one. So that means he's requesting the nurse to carry out an informal assessment. Okay, let's continue listening.
Sure. I'll report back to you either way.
Yes, please.
That's it. So he's not asking for advice on home visits. Actually, home visit is not mentioned. If our patient can move. If she was unable to do that, a community nurse, we would have needed a community nurse. But so that's not an issue. Then he's not asking for a regular feedback. He's asking, could you please keep an eye on her? That's where the request starts. If you find any concern, then we can have a formal one. So what she's now doing is informal. Okay, so Sanjeev, Blessy, Asma, Saina, and others, are you clear why B is the answer, not C, not A?
Yes, ma'am.
Okay, perfect. Let's move on to the fifth question for today. Asma, can you read the fifth question scenario for me, please? Unmute yourself, yeah.
Yes, ma'am. You hear a community pharmacist talking to a
patient. A community pharmacist is talking to a patient. Asma, can you read the question?
What concerns the patient about his medication?
So what do we need to find out? What concerns the patient about his medication? So what do we need to find out? Patient's
concern about
his medication. The patient has some concern about his medication. That's what we need to figure out. Okay. All right. Asma, can you read the options one by one?
As per he is understood the dosage instructions.
So is the patient concerned about his understanding of the dosage? Instructions on dosage. Next option.
Whether he has sufficient supplies for his needs.
So is he concerned about the amount of medication that he has, the sufficient, whether the medication that he has, whether it's sufficient or not, is that his concern? Next option, Asma.
Whether the correct type has been supplied.
Or is his concern whether he has the correct type of medication. So is the patient concerned about his awareness about the dosage, or is the patient worried about the sufficiency, whether he has enough supplies, or is he concerned about the correct type, whether he has the correct type of medication? All of you take a second, go through the question. Okay, here we go. I'm going to play the audio. Here we go.
How can I help you?
I just wanted to ask you something. You see, I've been given some pills for my heart condition. It was the consultant who prescribed them, and she said they were low-dose beta blockers, and that I should take them as and when, only if my heart started playing up, and then only until it got back to normal, then to stop. Anyway, my daughter picked the pills up, and I only noticed when I looked at the box that it says, take 1 tablet daily. So I went online, and sure enough it says they're beta blockers, but all the websites say that's how you should take them, not as and when. I mean, I just thought I'd make sure I've not got things mixed up in my own mind somehow.
OK, I can check that for you. Have you got the pills with you?
Okay, so that's it. What did you guys get as the answer? What was the answer? Is it A, is it B, is it C? Come on, tell me. What is the patient worried about? Sanjeev, Blessy, Saina, others, what do you think is the answer? Come on, tell me.
Option A.
Option A. Blessy thinks option A. What are they? A. Okay, you guys are correct. Answer is option A. Okay, all right. Option A is the answer. Let's just go through the audio to make sure all of us are on the same page. Here we go. Somewhere here. Yes.
How can I help you?
I just wanted to ask you something. You see, I've been given some pills for my heart condition. It was the consultant who prescribed them, and she said they were low-dose beta blockers.
So the patient is like, you know what, I have a concern about some medications prescribed to me by a consultant for my heart issue. And the consultant told that it's called beta blockers.
That I should take them as and when, you know, only if my heart started playing up, and then only until it got back to normal, then to stop.
So the consultant told him that, you know, about when to take the medication. She told whenever you feel like, you know, your heart is starting to be, when you feel not so good when it comes to your heart, then you can take the medication. And once you feel overall better, you can stop taking them. Okay, that was the consultant's advice to him for the when to take the medication for that question. Okay, let's continue listening.
Anyway, my daughter picked the pills up, and I only noticed when I looked at the box that it says, take 1 tablet daily.
So his daughter went and picked up the medications, and when she brought it back home, he noticed that below the tablet thing, it's written that they need to take the tablet at least once a day, 1 tablet a day. That's what is written. But the consultant told him when he feels not so good with his heart, he needs to take the medication, and once it's over, he can stop taking them. Okay, but in the box, it's written 1 tablet a day.
So I went online, and sure enough, it says they're beta blockers.
So he went online as well. Okay, because of his accent, that's not clear. He says, I went online. He went online and he checked it. So when he checked it, they confirmed that he has his medications are called beta blockers. Again, consultant told it's beta blockers. He did a research online. There also it's told beta blockers. So he's not worried about the type. Everywhere it's beta blockers. No, that confusion is not there. So we can reject option C. Online also said beta blockers. Consultant also said beta blockers. So that's not the problem. Let's continue listening.
But all the websites say that's how you should take them, not as and when. I mean...
So no, none of the websites said when to take it. Okay, so the consultant told him something. He found another thing on the box, and none of the websites told when to take it. They said it's a beta blocker and other things, but they never said when to take it.
I just thought I'd make sure I've not got things mixed up in my own mind somehow.
So that's why he's here, to confirm that he's not mixed up. He has not had anything mixed up. That means he's not confused, or he just want to clarify it. That's why he's here. So B is sufficiency of the medication. That's not mentioned at all. What is mentioned? Consultant said something. Box had something. Nowhere in the website dosage is mentioned. So that's why he's worried about whether he has got the dosage mixed up. That's why option A is the answer. Okay, all right, this is a very good question, and it's pretty straightforward, but don't get confused. And when he says when he says online, it's not very, because of the accent, many of you might not catch that word. It's online, so make sure to check that part as well. Okay, let's move on to the last question for today. Saina, can you read the scenario for me, please?
Yes, ma'am. You hear part of a safety briefing on a hospital ward on the subject of hand hygiene.
So this is a safety briefing. So somebody is talking about the safety aspect, and the subject is hand hygiene. Saina, can you read the question for me, please?
What is a speaker doing?
So what is the speaker doing? So we need to figure out speaker's
Action.
Right now. Speaker's action now is doing, not past action, not future action, right now. Okay, all right. Saina, can you read the options one by one for me, please?
Recommending a newly published training tool.
Okay, is the speaker recommending a newly published, completely new training tool? Next option, Saina.
Announcing a new way of assessing a standard training tool.
Announcing a new way of, what is the word, Saina, here?
Assessing.
Accessing. Assessing means evaluate. Access means, able to get. Okay, so announce. So is the speaker announcing a new way they can get hold of a standard training tool? So is the speaker recommending a new tool, or is the speaker announcing that there is a new way through which they can get the standard tool? Last option, Saina.
Suggesting a training tool to address a new problem that's a risk.
So is the speaker suggesting a training tool to deal with a new problem that they have? So is the speaker recommending a completely new training tool, or is the speaker announcing that there is a new way through which they can access the tool, or is the speaker suggesting that a training tool can take care of a problem that they are facing now? All of you go through the option, go through the question. The final question for today. Okay. All right. So I'm going to play the audio. This is the final question for today. Okay. All right. So those who have joined late, don't worry. We have recordings available. You can get access to it. So let's listen to the last audio. Here we go. Get ready. Look at the question. Look at the option. Get ready. The audio will play at any second.
So onto the question of hand hygiene. Now, in the questionnaire I sent round, many of you said you'd like to improve your hand hygiene compliance. Hand hygiene's always been important within healthcare, and the global COVID pandemic really brought this home to us. As you know, we replaced the rather uninspiring training videos on this subject with the Clean Hands interactive training package last year. And that's been getting lots of positive feedback, although take-up could be better, to be honest. With that in mind, you'll be pleased to hear that the package is now available on desktop and other platforms. This makes finding the time to engage with it so much easier, so there's no excuse for putting it off any longer. Infection control has never been so critical.
Okay, what do you guys think is the answer? Is it A, is it B, is it C? Which is the one? What is the one?
B.
B. Okay, all of you correct. Okay, but let's analyze to make sure that all of us are on the same page. Option B is the correct answer. Okay, all right. Let's see. Let's analyze it. Get ready. Here we go.
So onto the question of hand hygiene. Now, in the questionnaire I sent round, many of you said you'd like to improve your hand hygiene compliance.
So the speaker is talking about hand hygiene, and she's like, I had sent some questionnaire to you guys, and many of you told that you're interested in improving your compliance with hand hygiene.
Hand hygiene's always been important within healthcare, and the global COVID pandemic really brought this home to us.
So always hand hygiene has been an important issue, but something that drove that point home, something that, emphasized it more was the COVID pandemic.
As you know, we replaced the rather uninspiring training videos on this subject with the Clean Hands interactive training package last year.
So last year, what they did was there was a training. They used to have a boring video. Now they changed it to a new version of it. Okay, much more interactive version of it. Okay, so she's not talking about a new one. She's talking about one that was published last year. Okay, let's continue listening.
And that's been getting lots of positive feedback.
So they had a positive feedback on some tool or a video thing, the interactive video thing that they introduced last year.
So take-up could be better.
But she's like, I got positive feedbacks, but I believe more of you could take it up. That means take up. People taking the interactive tool, that could be better. Okay, the number of that could be better.
To be honest. With that in mind, you'll be pleased to hear that the package is now available on desktop and other platforms.
So considering all this, I'm happy to inform you that that particular interactive package is now available on your desktop and other platforms. Okay, so she's introducing so the tool that they are talking about. There are now many other ways to access it. They can get it through their desktop, or there are other platforms where they can get access to it. Okay, so that's why she's saying, I'm happy to inform you. So when you are announcing something, you usually say, I'm glad to inform you. I'm so happy to inform you. See the language. Okay, so that itself says B is the answer, but let's continue listening.
This makes finding the time to engage with it so much easier, so there's no excuse for putting it off any longer. Infection control has never been so critical.
So she's like, you know what? So now nobody have any excuses. It's available on your system. It's available on various platforms. So make sure that you join in. There is no excuse. And like always, care has been, infection control is very critical. So infection control of hand hygiene is not a new problem. It has always been there, and now it's more critical. So C and A you can reject. Answer is B. And remember, announcing. When she announced, she uses, I'm happy to inform you. I'm pleased. You will be pleased to know. You'll be pleased to know that, like that. And remember, in the earlier question, when requesting, could you please, see, remember this language. When you're requesting, so please, could you please keep an eye on her? That's request. Okay, in 30th question, last question, when she was announcing, she used the language, I'm so glad to inform, or you will be pleased to know. Okay, so remember this language to quickly find out your answer. So this is how you this is what part B is all about. This is a very new material. Make sure to go through this again. So whatever features that we find in this new materials, that means you can expect such type of features or characteristics for your exam as well. Okay, so that's it for today's morning session. So let me tell you a few things before we wrap up. So today evening, we will be having a look at listening part C, a presentation. Okay, again, I'm using a new material. Okay, then tomorrow Saturdays, we don't have evening sessions. We only have morning session. And remember, tomorrow morning, we will be having a look at a case note. We will be discussing how to select the information. We will be discussing organization. That is our first session on organization. So I wanted to inform you that. Okay, so in-depth analysis will be done. Us together, we will come up with the organization. We will think about selecting. We will think about how to approach a case note, all those things. Okay, and evening, we will be discussing a presentation. I just wanted to inform you that. So I think that's it for the morning session. Those who have joined late, you can get the recording. Just talk to Gia ma'am. Okay, and I will be sending this material and one extra material in both groups. Okay, all right. So that's it for today. Any questions for me? Any questions?
Yes, ma'am, where I can get the Gia ma'am number?
Okay, it's there in the poster. Veena, from where you got the invite, there itself they have written the number. You can just contact them. She will definitely give you access. You need to join the course and you will get access. Okay?
Okay.
All right, Veena. Okay, so that's it for today. I'll see you guys in the evening. Okay? All right. Thank you.
Thank you.
Thank you, ma'am.